more mental health patients, mentally ill patients in prison today than there are in mental hospitals. So they're either living on the street because they got no other place to go, or they're in prison.
You come across as weird, awkward, somebody they don't want to hang around with.
Let's see, my name is John Schulte, and here's one of my cards.
Thank you.
I have a Bachelor of Arts degree, cum laude, major in psychology from University of Missouri at St. Louis. I have a Master of Science degree in clinical psychology from Indiana State University at Terre Haute. And I have a Doctor of Psychology, PSYD, in clinical psychology from Central Michigan U at Mount Pleasant.
I'm a special education teacher.
Right. Do you know a lot of stuff about mental disorders or illnesses?
I do. That was actually part of my course of study when I became a special education teacher.
So, my name's Scott Crowder, MD, and I went to, backing up quite a ways away, I went to Wake Forest University from 1984 to 1988, and then I went to the University of South Florida College of Medicine in Tampa, Florida from 1988 to 1992, and then I decided to go into psychiatry, and I did my adult and then my child and adolescent fellowship at UNC hospitals in Chapel Hill from 1992 to 1997, and I've been in practice here in Wilmington now since 1997. If someone comes in and says, I'm very depressed, and as they're talking, I hear them say, I'm such a bad person, and every time I make a mistake, I'm such an idiot. Nobody likes me. That tends to put a little message in our heads that, hey, cognitive therapy would be very helpful for this person, because it's important to start asking them some questions about their thought processes. If they come in and say, I'm very depressed because my boyfriend or girlfriend or spouse, we are not getting along, and here's how I communicate. We might say, well, it looks like interpersonal therapy would be a good idea for you. Let's take a look at how you communicate certain things. It tends to push people away. Maybe if you learn a little bit of skills, they may want to be closer and you might feel better. If we learn that there's maybe been some trauma in their life, if through the initial evaluation they say, yes, I went through a very stressful time in my childhood, abuse, divorce, we may want to explore that. Sometimes there's unresolved grief that someone's depressed later in life over.
For depression, a lot of people can deal with depression through therapy, psychotherapy alone. They could also use medication alone, but the most effective is typically a combination of the two.
There's behavioral therapy where we feel like someone's just, not kind of getting themselves out and exercising or getting to work, or there's times we just say, look, here's the plan, and we take a more directive approach.
I struggle with anxiety I'm on medication for anxiety.
What medication?
I'm on Wellbutrin.
Now with anxiety, there's sometimes there's a unique aspects of anxiety. Some people have kind of phobias or social anxiety, very fearful. So we would like to help them gain some confidence that maybe they can do these things. So we use a particular type of therapy called systematic desensitization, where we will say, let's say for an analogy would be swimming, I'm scared to swim. You don't take the person and throw them in the deep end. You say, let's start at the first step. Here, let's sit on the side of the pool and put your legs in. Same kind of thing. I'm scared to death to be in front of a crowd. Well, let's practice talking in front of your friend. Now let's practice talking in front of a few more people. So it's just a build up in terms of being able to handle the anxiety. Eating disorders cover several different types. Some people have anorexia, where there's a significant amount of weight loss and continue to diet and not eat and exercise a lot. Sometimes people have just bulimia, where they'll have binge eating episodes, then feel very guilty, and then maybe purge or take laxatives, and then sometimes people have both.
Eating disorders, most of the time there's an accompanying either anxiety or depression that you have to deal with as well. And most of the time when medication is used, it will be in the form of an SSRI, like Prozac, Paxil, Zoloft, one of those. That helps with mood, but also helps take some of the edge off the anxiety without the risk of being addictive, like Xanax or something like that.
The therapy, again, depends on each person, but it's a lot of behavior therapy along with family therapy, because the focus at the onset is refeeding and increasing calories and getting a person back just to being energetic. It's difficult to treat a person and their brain if they have very little energy and very little mental processes because they are so malnourished.
I've worked with students that have had anorexia and bulimia.
Sometimes the bulimia with the purging is we all at times might notice we eat something, maybe we're under some stress, and boy, that sweet was good, and I felt a little comfort. Some people get dysregulated about that and can't turn it off. And then they feel terribly guilty about it later. And then they might go, as I said, throw up, make themselves throw up. We can try to help them learn more ways to regulate their emotions so that there may not be that rush to dampen it down with excessive amounts of food.
Psychotherapy is the main, I would say, the main effective treatment for eating disorders. There's individual therapy, family therapy, and group therapy have all been used effectively. I think with anorexia in particular, the family approach is really important. Usually the patient is younger and more influenced by their family, and also more often than not there's a power struggle in the family, and that's one area where the patient tries to have some control over her life, because one of the things that the parent can't do is make them eat. So they feel out of control with everything else, because usually they have an over-controlling parent that's telling them everything to do, what friends they can have, what they have to wear, everything. And it's like, you gotta turn those dynamics around, let them have control in their life in other ways other than eating.
When I was in high school, my freshman and sophomore year, I had an eating disorder. Didn't really think of it as that when I was doing it, but wasn't eating hardly anything, was exercising all the time. I had to be seen by someone, and it wasn't very long. I never got committed for it. I never was having to, be in the hospital for it. My parents were also they hovered over us. So it was very apparent when they started noticing that I wasn't eating. You don't look, it's not like a physical thing that you see.
Yeah.
So people don't recognize it as it's a disability.
Mm-hmm.
it's debilitating.
Mental health treatment is grossly underfunded today. When I started practicing 40 years ago, it was easier to get, treatment was more accessible to those that needed it the most. Those that had the most severe disorders could get help. And now, through the years, many of the mental health centers have closed down. The psych hospitals have closed down. The psych units have either cut back or closed down.
Nothing to be ashamed of. It's not a weakness. It's not a defect. And that people can be a little more open that I got a problem right now and it can get better, and that doesn't define me as a weak person or a bad person.
I had a patient that came in that was on Medicaid because they were poor, and everything. And this patient was delusional and really needed some care. Medicaid won't pay private practice people. They'll only pay if you go to the state-run mental health centers or whatever. So I called up the mental health center and I said, I've got a patient for you I'm referring. They're going to need individual therapy as well as seeing a psychiatrist for medications. And they said, well, we don't do individual therapy anymore. We've got a support group that can go in and they can see the psychiatrist once every 3 months. Yeah. So what happens is, they go to see the psychiatrist, they get medication, and because of their disorder, they stop taking it because they think they don't need it, or they get paranoid or whatever. And then they get worse and they either end up back in the hospital or they end up being arrested for something. And so that's the direction we've been going in.
I don't think there is enough awareness of mental health. And I think it is probably one of the most important things that we recognize. It controls every aspect of our life. Well, that's mental health.
Therapy is not just tell me about your childhood, it's also providing a lot of education. People with bipolar disorder, people with schizophrenia, they need to be educated about the chronic nature of their illness, the flare-ups that can occur, the importance of family support, the importance of taking medication. There's a lot of things that go into therapy that are very educational in certain diagnoses as well.